Hi, this is Lyrich Luis, first-year student taking a Bachelor of Science in Business Administration, major in Financial Management 1A. This video is the continuation of my mental health advocacy program. In the first part of my advocacy, I've defined mental health, the difference of mental health from mental illness, and I have stated some common mental illness people are experiencing. Now, I will talk about how we are going to treat or overcome mental illness as well as how to handle our mental health in a good way. Mental illness is treatable. When someone experiences symptoms of mental illness, it is important to seek help from a general practitioner. Despite the persistence of some continuous symptoms, the right treatment can help a person's condition improve or make them live well. Psychological treatments can be beneficial to persons that are suffering from mental illness. However, medications may be required in some cases, particularly if symptoms are having a massive impact on a person's life. Symptoms can be so confusing for the individual experiencing them that they are unaware that they are ill. In this situation, family or friends should seek help and guidance from the doctor on how to best treat the person. Let's look at the most common ways to overcome mental health issues. Number 1 is know who your enemy is. A person should conduct analysis and get knowledge about a certain illness or group of conditions that they are dealing with. They need to be aware of the types of negative thoughts and behaviors they are dealing with. Furthermore, a person with mental health concerns should not allow their illness to govern them. A person who is dealing with a problem must learn to handle the issue and strive to keep it from taking over their life. They must learn to diagnose themselves and recognize the thoughts that are causing them to suffer. Your thoughts are not you. Most of the time, a person with mental health concerns has trouble with their thinking. Some of them take it too seriously, and as a result, they have grown sick. People who are affected by this must realize that their thoughts are just that, thoughts. These thoughts must not be used to bully or hurt anyone. People should refuse to believe in them and should not provide them authority. Number 3. Seek support. Everything cannot be done and managed oneself. A person who is having problems should seek help and support. They must share with close friends and family, but they must be careful about who they trust in. Not everyone will be compassionate or helpful in a scenario involving a person with mental illness. They can, on the other side, discover local help, a therapist, and a support site as well as make touch with positive people through that site. Number 4. Say no to shame. Mental health issues are as normal as physical illness. There is nothing to feel ashamed of flu or any other disease. Statistics suggest that 1 out of 4 suffer from mental illness at some point in their lives. In fact, just about everyone will have at least one period of mental instability in their lives, even if it's not a diagnosable condition. One must try to face mental illness with dignity and courage. Besides, they should help other people going through tough times from their experience. Number 5. Take care of people near you. It takes more than one individual to overcome a mental health problem. It's also about the other individual who are suffering from mental illness. Sufferers are also specialists, having more experience than anyone else. Those persons with a wealth of knowledge about the topic should try to assist others in overcoming their difficulties. That's all for our second part of our mental health advocacy. See you in my next one.